300 million people are affected by diabetes worldwide, and this number is predicted to increase. Diabetes is the leading cause of blindness, or a leading cause of blindness, renal failure, and it's a major risk factor for all forms of cardiovascular disease.
Ahead of World Diabetes Day this Sunday, Ultan Larney, who has type 1 diabetes, and his mum, Maire Larney, along with Consultant Paediatrician Dr. Edna Roche, all join us now to discuss the condition. You're all very welcome, one and all. Ultan, before we come to you, because you're the only person here suffering with diabetes, so you can tell us what it's really like. Edna, I want to come to you because this is a huge ticking time bomb, really, diabetes, particularly type 2.
Certainly we're seeing an increase in both types of diabetes worldwide, both type 1 and type 2. But by far the majority of diabetes worldwide is type 2, which is estimated to go from 300 million to 450 million in a very short period of time. Can
you simply explain the difference between type 1 and type 2, and maybe explain a little bit about diabetes?
I suppose the key issue in terms of diabetes is that the body loses the ability to handle sugar effectively from the food. So it's unable to use sugar as a source of fuel without insulin, because in type 1 diabetes, the diabetes that classically children get earlier in life, and people can get throughout their life, but classically the majority of it starts before the age of 15. That's where the body stops producing insulin. So insulin has to be given in from the outside, currently in the form of injections.
Okay.
Type 2 diabetes is a combination of reducing the amount of insulin you produce, but also that the body becomes more resistant to how the insulin works.
Oh, okay.
And in type 2 diabetes, a lot of that can be exaggerated by gaining extra weight and obesity. So that certainly would be the big driver of type 2 diabetes.
And let's talk about symptoms of type 2 diabetes. What should people be looking out for?
Certainly people with type 2 should be looking out for drinking a lot. So this very large thirst, passing a lot of urine, maybe getting up at night to pass a lot of urine, tiredness and blurred vision and things like that can be the warning signs of diabetes. Obviously they can be other things as well, but they can be the warning signs of diabetes, and particularly if you're carrying extra weight.
So weight that seems to be one of the major issues with type 2?
With type 2,
yeah,
absolutely.
Okay.
It certainly is one of the major issues.
And with type 1, are we looking at different symptoms or similar symptoms?
We're looking at similar symptoms with type 1 with a much more abrupt course. So with type 2 diabetes, it's much more slowly evolving, can often tick away in the background for quite a long time, doing some damage before you realise that you have it. We estimate that probably 2 people have diabetes for every one that we know about. So every one person who knows they've got type 2 diabetes, we probably have 2 people out in the community who have it, but haven't recognised the symptoms or maybe haven't acted on the symptoms. With type 1 diabetes, it's much more abrupt. So classically, children would experience symptoms generally over about 3 to 4 weeks, where they're drinking a lot, they're passing a lot of urine, they're up at night, they're very tired, they're very hungry often despite eating a lot.
Huge amounts, yeah.
They lose a lot of weight, so they would tend to lose weight rather than the other direction.
That's our key to bring Ultan in, and Maire. Ultan was very young. He was 2 when he was diagnosed, so how long before that did you notice that there was something wrong?
Well, actually it was really over a course of about 3 weeks. He'd been a very healthy baby right up to about within 3 weeks of the diagnosis, and like that the symptoms, you know, he lost weight quite rapidly. He was, you know, the excessive thirst, very, very tired. At that stage he was still in nappies, but I was changing his nappies all the time, you know. And he actually had a head cold, and that was why I brought him to the doctor and so on. But it happened within 3 weeks. You know, he was...
And we were saying earlier on, I know a little bit about this because my brother has type 1 diabetes, but he was diagnosed when he was 12. When poor Ultan was just 2 years of age, you obviously had to inject him, which must have been quite traumatic for Ultan and for yourself.
It was, yes, it was. Even doing the blood tests, never mind the injections, that was traumatic because you were, you know, he was getting, from Ultan's point of view, Mammy's sticking pins in me, she's hurting all my fingers, you know, and then we were injecting him and he really objected to that. We used to have to literally pin him down, hold him down.
I suspect object is a polite word.
Yes.
Do you remember that at all, Ultan?
No, I don't remember it at all. I was very young at the time, so I don't remember back.
And that's probably an advantage in some senses because you've been used to it since you were a child, and you know, human beings and children in particular are very adaptive, very flexible. So tell us your day now as a type 1 diabetic. What does the day involve for you dealing with this?
Well, I get up every morning for school. I get up at about 7:30. I check myself, and depending on
that?
I have a meter. It's very small. It's in a black pouch, and it has a finger pricker with a needle in the base of it, and you load it up and you press the button and it'll inject into your finger, and you put the blood onto a strip that's inserted into the meter, and the meter will read and give you your reading. And
that reading tells you what?
Tells me my
what
blood
your blood sugar is, yeah. And do you have a kind of a critical number that you know it must never go below?
Well, there's a critical one for the high and the low. I like to be between like 4 and 8, that's the good readings, and anything above 10 and below 2, it's not good.
And what would it be like first thing in the morning, usually?
It's usually good because I've had a good night's sleep, or I'd be out the night before, like playing sport or out with my friends, and it does be good, maybe 5, 6 in the morning.
Okay,
you know,
when's your first injection then?
It's in the morning time before my breakfast.
Now, I think a lot of people, even people who don't know anything about diabetes, will be familiar with the kind of what they call the pen needle, or the what do they call them, needle guns or something like that. How often a day would you inject yourself?
It's usually 4 to 5 times a day. I have 2 pens, 2 different types of insulin. I take one before supper, and the other one I use during the day before meals.
Now, you obviously you have to take this with you wherever you go, or you carry it with you wherever you go, do you?
Yeah, I take it just everywhere with me.
Okay.
Wherever I go, if I go to sport, swimming, if I'm going to town at the weekends, I take it everywhere with me.
Yes, I was going to ask you, do you feel that it prohibits you from doing or prevents you from doing anything in your life, or is this now just a normal part of life, and as long as you do it, you'll be able to do what everybody else can do?
Well, like I've had it since 2, so I know exactly what to do, and it doesn't stop me at all doing what I want. Like, I can do it and like a normal person.
You've never forgotten it, or you've never let it go a little too far, or pushed your luck with it, no?
Well, yeah, I have.
Because it is difficult, because you have to watch what you eat. So it means, like, if you're on the way home from a football match, you can't just grab a Mars bar and hoof it down your neck. I mean, you do have to be very disciplined and very strict with yourself, which is tough when you're someone your age.
Yeah, but all you can do is try your best. Like, you have to give 100%, just like anything else, and I just try to do what I can.
And you are very in control. Your levels are very good, you were telling me. You're pleased. Maire, is he a good boy? Is he looking after himself?
He is, yes, he is. I suppose now at this stage, he's becoming more independent. You know, when he was young, I suppose it was my job, you know, but now as he's getting older, I'm having to let go, and he's proving, you know, that he can do it for himself, you know.
Fair play.
Still keeping a strict eye on it, though, I suspect.
Well, I have to step back, just like with any teenager. You have to step back and let them make
They kind of surprise you when you
mistakes
actually
and
give
go
them the trust and they live up to it, isn't it? They do eventually.
Have you had scary moments, Sultan? Have you had lows? Have you had...
yeah, I've had
the
a
odd
few,
one or two,
yeah, I deal with them as best I can, you know. I try and do my best every day.
Good for you. Well done, Ultan.
I mean, the size of this time bomb, Edna, is absolutely extraordinary, because the maybe one of the most all-pervasive ingredients in food and in life is sugar. It's almost impossible to avoid it. So it's, unless we really get a grip of this, we're in big trouble 20, 30 years down the road, aren't we?
Certainly, and that's dealing with the type 2, but we also have an increased instance of type 1 diabetes, which is the type of diabetes that children tend to get very early in life, as Ultan had, that can go right through your whole lifespan as well, which is very
quickly before we go, this Sunday in it's at the Dublin's O2.
Well, the actual event is at the Burlington Hotel. 12 to 5, Burlington Hotel. There's a Diabetes Awareness Day with all information. You can get free cholesterol test, free blood test, free everything else. But they're turning the wheel blue,
the big
I think.
wheel, the revolver wheel, will turn blue to mark World Diabetes Day on Sunday. And also there will be blood and glucose testing provided for the public at the wheel, courtesy of Novo Nordisk, or a global healthcare company. So it's a good day out. Go down there, go and support it, obviously. And if you think you may have any issues at all, you can be tested on the spot.
Myself and my brother are going into the Burlington on Sunday. We might see you there.